There is a moment that happens in millions of homes every single morning, right after the alarm goes off, right before the coffee is even poured. A small pill is picked up off the kitchen counter, swallowed with a sip of water, and forgotten about for the next 24 hours. It feels like nothing. It feels routine. And for most people taking blood pressure medication, that small automatic moment is treated as the least important part of their entire day. But here is something worth sitting with for a second. For more than a decade, some of the most respected hypertension researchers in the world were genuinely unsure whether that moment, morning versus evening, could be quietly influencing the risk of stroke, heart attack, and even death. Not the medication itself, not the dose, just the clock. That question sounds almost too small to matter. A pill is a pill, whether it goes down at 7 in the morning or 10 at night, right? And yet it took a study of more than 21,000 people, followed for over 5 years, to finally get a real answer. What that study found and what it didn't find changed the way cardiologists talk to their patients. And buried inside that research is a second, quieter finding that almost never makes it into the conversation, one that has far more to do with your safety than the hour on the clock. By the end of this, you'll understand exactly what the science actually says about timing, why the old advice many people still follow was built on shakier ground than anyone realized, and what the real, practical risk is that almost nobody warns you about. It isn't dramatic. It isn't rare. And it's something you can check on yourself today without changing a single thing your doctor prescribed. Let's start with the biology, because none of this makes sense without it. I'm Dr. Everett Cole. I've spent years helping older adults understand the small, everyday habits that quietly shape heart health, blood pressure, and healthy aging. My goal isn't to replace your doctor. It's to help you understand the science behind your treatment so you can have better conversations and make more informed decisions. Now, let's look at what the evidence really shows. Your blood pressure is not a flat, constant number sitting quietly in your arteries all day. It rises and falls in a rhythm, almost like a tide, tied to your internal body clock. While you sleep, blood pressure normally dips, sometimes by 10% or more compared to your waking hours. Then, in the hour or two before and after you wake up, something interesting happens. Cortisol rises. Adrenaline-related hormones rise. Your nervous system shifts out of its restful, rest and digest mode and into its alert, get moving mode. Blood pressure climbs, sometimes sharply, in what researchers call the morning surge. This isn't a malfunction. It's ancient wiring, the same system that once helped your ancestors get up and start hunting or gathering the moment the sun rose. But in a body with stiffened arteries, narrowed vessels, or years of unmanaged hypertension, that morning surge is also the window when a disproportionate number of strokes and heart attacks actually occur, not evenly throughout the day, concentrated quietly in those early hours. So the logic that researchers followed decades ago was reasonable on its face. If blood pressure medication works most powerfully for several hours after you take it, and the most dangerous surge happens in the early morning, then maybe taking your pill at night, so its peak effect lines up with that surge, could offer extra protection. It's the kind of idea that sounds almost too elegant not to be true. And for a while, some research seemed to back it up in a big way. Spanish research groups published striking results suggesting that people who took their blood pressure medication at bedtime had dramatically fewer heart attacks, strokes, and cardiovascular deaths than people who took it in the morning, differences large enough to make headlines and change prescribing habits in clinics around the world. For years, "take it at night" became something patients heard from well-meaning sources, sometimes even printed on pharmacy handouts. Here's where the story gets more interesting, and where the hidden problem really starts. Independent scientists who went back and examined those early bedtime dosing studies started noticing things that didn't quite add up. The way patients had been assigned to morning or evening groups appeared inconsistent in ways that could skew results. The cardiovascular events used to judge success weren't independently verified by outside reviewers, meaning the same team that ran the trial was also the one deciding what counted as a heart attack or stroke. And the size of the benefit being reported was frankly larger than almost anything else in cardiovascular medicine has ever shown, from something as simple as changing the clock on a pill bottle. When something looks too good relative to everything else we know, that's usually a signal to look closer, not to celebrate faster. So a wave of tighter, more rigorously controlled trials followed. A crossover study called Harmony put patients through both morning and evening dosing schedules and measured their blood pressure continuously over 24 hours using ambulatory monitors strapped to their arms, not just occasional readings in a clinic. The result: no meaningful difference in blood pressure control between the two timing strategies. Then came the big one. In 2022, a trial known as TIME, Treatment in Morning versus Evening, published its results in The Lancet, one of the most respected medical journals in the world. More than 21,000 people with hypertension, average age 65, were randomly assigned to take all of their blood pressure medications, either in the morning or in the evening. They were followed for more than 5 years. The primary question was simple and enormous. Does the timing change your risk of vascular death, heart attack, or stroke? The answer, after all that time and all those patients, was no. The rates of these major cardiovascular events were essentially the same in both groups. Morning blood pressure readings were, unsurprisingly, a bit lower in the morning dosing group, and evening readings were a bit lower in the evening dosing group. The medication was simply working hardest a few hours after each dose, which is exactly what you'd expect. But when it came to the outcomes that actually matter to your life, did you have a stroke? Did you have a heart attack? Did you survive? The clock made no measurable difference. In 2024, researchers pooled together the data from TIME and every other well-designed trial on this question into one large meta-analysis, presented at the European Society of Cardiology's annual Congress. The conclusion echoed what TIME had already shown. There is no proven cardiovascular benefit to evening dosing over morning dosing. The researchers were direct about it. Take your blood pressure medication whenever fits your life and your habits best, because that consistency is what actually protects you. So if you've been quietly worrying that you've been taking your pill wrong all these years, you can let that particular worry go. That's not a small thing to hear, and it's worth pausing on, because a surprising number of people carry low-level anxiety about details like this without ever getting a clear answer. But, and this is where the story turns towards something that deserves your full attention. Inside that same TIME trial, buried in a secondary finding that got far less coverage than the headline result, was something genuinely useful. Falls were slightly less frequent in the group that took their medication in the evening, not dramatically. Not enough to rewrite guidelines, but enough to point toward a real physical mechanism that almost never gets discussed openly with patients, and that has much more to do with your day-to-day safety than which side of noon your pill lands on. Here is the mechanism, and once you see it, you'll probably recognize it immediately. Many people on blood pressure treatment are also taking a diuretic, a medication designed to help the kidneys clear excess sodium and fluid from the body, which lowers blood volume and, with it, blood pressure. It's one of the oldest, most effective, and most widely prescribed classes of blood pressure medication in the world. It also does something very predictable. It increases how often you need to urinate, and that effect is strongest in the several hours right after you take it. Take that diuretic in the evening, and the increased urge to urinate often peaks right in the middle of the night, pulling people out of bed, sometimes more than once, during the hours when the house is dark, the body is groggy, and the risk of tripping over a rug, a pet, or a piece of furniture is at its highest. Layer on top of that another piece of biology. Many blood pressure medications, especially right after waking or right after standing up from lying down, can cause a brief dip in blood pressure as the body adjusts to a change in position. Doctors call this orthostatic hypotension. It's the lightheaded, slightly floaty feeling some people notice when they stand up too fast. Combine a half-asleep walk to the bathroom, a body still adjusting to being upright, and blood pressure medication working exactly as intended, and you have one of the most common and most preventable causes of falls in older adults. This is the part of the story that almost never gets its own spotlight, because check your fall risk doesn't sound as dramatic as you've been taking your pill at the wrong time. But for someone over 65, a fall is not a minor inconvenience. It's one of the leading causes of serious injury, hospitalization, and loss of independence in that age group. And here it is, quietly connected not to some rare complication, but to the completely ordinary everyday act of getting up to use the bathroom at 2 a.m. Let me walk you through how this tends to show up in real life, because the pattern is remarkably consistent across the patients who experience it. A woman in her early 70s, active, sharp, still gardening most mornings, had been managing her blood pressure with 2 medications for almost a decade, including a diuretic she took every evening after dinner, the way she'd always been told. She never thought twice about it. Over the past year, she'd started waking 2 or 3 times a night to use the bathroom. She chalked it up to age, the way so many people do. Getting older, she assumed, just meant a smaller bladder and worse sleep. She never mentioned it to her doctor because it didn't feel like a medical problem. It felt like a fact of life. One night, walking back from the bathroom in the dark, she caught her foot on the edge of a nightstand she'd walked past thousands of times before. She went down hard, fractured her wrist bracing the fall, and spent the next 6 weeks unable to drive, garden, or fully care for herself. During a follow-up visit, almost as an afterthought, her doctor asked what time she took her diuretic. When she said after dinner, the doctor gently pointed out that shifting that one medication to the morning, not changing the dose, not changing the drug, just changing the hour, could reduce those nighttime bathroom trips substantially. Her other blood pressure medications stayed exactly where they were. This kind of scenario plays out, in some version, in an enormous number of households. Not because anyone did anything wrong, but because what time do you take your water pill is a question that rarely comes up in a routine 15-minute appointment focused on blood pressure numbers and refills. So why does this get missed so often? Partly because the symptoms don't look like a medication issue. Frequent nighttime urination gets filed under aging, or an enlarged prostate, or just how sleep is now. A little dizziness on standing gets filed under low blood sugar, or dehydration, or simply moving too fast. Each of these on its own seems minor enough to mention only if a doctor happens to ask the right question at the right visit. And because the connection between diuretic timing and nighttime falls isn't dramatic or new, it rarely gets its own conversation. It hides in plain sight, tucked inside a dozen other more important-sounding topics competing for time in a short appointment. There's another layer worth understanding, because it explains why this issue can quietly worsen over months or years without anyone noticing. As blood vessels age, they naturally lose some of their elasticity, a process called arterial stiffening. Think of a young, healthy artery as something like a flexible garden hose, able to expand and contract smoothly as blood pressure rises and falls throughout the day. An aged, stiffened artery behaves more like an old, dried-out hose, less able to buffer sudden changes in pressure. That stiffness makes the body's blood pressure swings, including the dip that happens when you stand up, more abrupt and less well-cushioned. Combine that underlying stiffness with a blood pressure medication working at its peak strength, a half-asleep nervous system, and a body just shifting from lying to standing, and you have several separate, ordinary aging processes stacking on top of each other at exactly the wrong moment. None of these individual pieces are secret. Cardiologists know about arterial stiffening, urologists know about nocturia, geriatricians know about fall risk. What's missing isn't hidden knowledge. It's that these specialists rarely sit in the same room together, looking at your medication list as a whole, asking the one connecting question, what time of day are you taking each of these, and how is that interacting with everything else going on in your body right now? This is where the practical part of this conversation matters most, because the goal here isn't to make you anxious about a pill you may have taken safely for years. It's to hand you a short list of things worth checking, gently, with the people already caring for you. The single most useful thing you can do is notice your own pattern, honestly, without judgment. If you're waking up 1 or more times a night to use the bathroom, that's worth mentioning at your next appointment. not as a minor annoyance to work around, but as a specific symptom tied to specific timing. If you feel lightheaded, foggy, or unsteady in the first few seconds after standing up, especially first thing in the morning or after sitting for a long stretch, that's also worth naming clearly, because it's a recognizable sign of your blood pressure adjusting more slowly than your body is moving. For most people, the overall message from the best available research is genuinely reassuring. The exact hour you take your blood pressure medication, morning or evening, does not appear to change your risk of heart attack or stroke. What matters far more is taking it at roughly the same time every single day, so your blood levels stay steady rather than swinging unpredictably, and so you don't accidentally skip doses because the timing wasn't anchored to a consistent daily habit. Consistency, not the clock position itself, is what the evidence actually supports. Where timing can matter, specifically, is with diuretics, and specifically because of their effect on nighttime urination and fall risk. And that's a conversation worth having directly with your doctor or pharmacist, not something to change on your own. Some people genuinely need evening dosing for other medical reasons. Some people are on combination pills where separating the components isn't straightforward, and some blood pressure patterns actually benefit from a doctor deliberately choosing evening dosing for a specific, individualized reason. This is not a one-size-fits-all fix, and it's not something to reshuffle based on a video, no matter how well researched. It's something to bring to the person who can see your full history, your other conditions, and your full medication list together. It's also worth asking, plainly, whether you're on a diuretic at all, and if so, which one, because not all of them behave the same way throughout the day. It's worth asking whether your other blood pressure medications could be contributing to that early morning dizziness, and whether standing up slowly, pausing at the edge of the bed for a moment before rising, sitting on the edge of the mattress before standing fully, could reduce your risk while everything else stays exactly as prescribed. Small, deliberate movement changes like that cost nothing and carry no medical risk, unlike changing a dose or stopping a medication on your own. And if you do fall, even a small stumble that seems to end without injury, that's worth mentioning to your doctor too. A fall isn't just an event to move past quickly. It's information. It's your body telling you something about how your medications, your blood pressure, and your balance are interacting in that particular moment of your day, and it deserves a real conversation rather than a shrug. Here's a question worth sitting with for a moment, honestly. When was the last time you or someone you love got up at night to use the bathroom? And how steady did that walk back to bed actually feel? Not dramatic, not an emergency. Just, honestly, how steady? If the answer is not as steady as it used to be, that alone is worth bringing up at your next visit, even if nothing else about your health has changed. If you've experienced this yourself, or you're caring for a parent or spouse who has, it's worth sharing that experience with the people around you, because so many families quietly assume nighttime bathroom trips and morning dizziness are just an unavoidable part of aging, when sometimes they're a modifiable side effect of medication timing that a 5-minute conversation with a doctor or pharmacist can meaningfully improve. So here is where all of this actually lands. The old idea that evening dosing dramatically protects your heart more than morning dosing has not held up under the most rigorous, largest-scale testing available. That's not a loss. That's real, hard-won clarity after years of uncertainty, and it means you can stop worrying about getting the clock wrong. The real, evidence-backed insight hiding inside that same research is quieter and more personal. For some people, particularly those on diuretics, the timing of that specific medication can meaningfully affect nighttime falls, and falls are one of the most serious, most preventable threats to independence in the years ahead. The one thing worth doing today, before you do anything else, is simply looking at your medication list and noticing which ones you take in the evening, and asking yourself honestly whether nighttime bathroom trips or morning dizziness have become part of your routine without you really registering them as medical symptoms. Then bring that observation specifically to your doctor or pharmacist at your next visit or your next phone call. Don't change a dose, don't skip a pill, don't shift your own schedule based on anything you've heard here or anywhere else. This is a conversation to have with the person who knows your full medical picture, not a decision to make alone. For years, people argued about whether morning or evening was the right time to take a blood pressure pill. After decades of research and one of the largest hypertension studies ever conducted, the answer turned out to be far simpler than anyone expected. For most people, the clock is not the greatest threat. Inconsistency is. Hidden side effects are. And the symptoms you've quietly accepted as just getting older may deserve a second look. If you're waking several times a night to use the bathroom, if you feel lightheaded when you stand, or if you've had even one unexplained stumble recently, don't ignore it. Those aren't just inconveniences. They're important pieces of information your doctor needs to hear. At your next appointment, ask one simple question. Could the timing of my medications be contributing to these symptoms? That single conversation may do more for your safety than changing the hour on a clock ever could. And please don't stop, skip, or reschedule any medication on your own. The safest changes are always the ones made together with the clinician who knows your medical history. I'm Dr. Everett Cole. My goal is simple, to help you understand the science behind everyday health decisions so you can protect your heart, your mind, and your independence for years to come. If you found this helpful, subscribe and join me for the next video. We're going to uncover another common blood pressure habit that millions of adults over 60 follow every morning without realizing it may be working against them. Until then, stay informed, stay curious, and take good care of yourself.